This is a public service announcement from Transcape Assurance Brokers. What should you do if you get coronavirus? If you think you have coronavirus, you should isolate yourself immediately to the best of your ability and do not panic. There are only 20,000 test kits available in South Africa. Therefore, not everybody who displays the flu-like symptoms will receive a test. A doctor will make an assessment to give a test based on the following factors. Has the patient been in contact with someone with coronavirus? Or has the patient been in contact with somebody suspected of having coronavirus? Or has the patient been to an area that had coronavirus? Does the patient have a fever, a cough, and a difficulty breathing? This needs to be all three symptoms. Here are the known symptoms of coronavirus. Here is a link to places where you can get tested in South Africa. Steps to take if you have coronavirus. Self-isolate and self-quarantine yourself so that you don't infect others. If you are on a medical aid, then you need to go to a GP in your network to be referred to get a test. If you are not on a medical aid, you will have to go to a government hospital. A test is free of charge. A private hospital, which could cost up to 3,500 Rand, as per advice from the National Coronavirus Hotline, 082 00 029 999, or go to a pathology lab after a referral from a doctor. The World Health Organization will pay for any positive tests. So if you take one of the 20,000 tests available in South Africa and you are not positive, your medical aid will not pay. If you would like some more information, you could call the coronavirus hotline, but I waited an hour and 45 minutes to be told relatively a few things. If you would like more information, I have attached links in the description. Do not panic. The virus has a low mortality rate, but Cov19 is more lethal in people that are above middle age, obese, smokers, have high blood pressure, heart disease, lung disease, cancer, diabetes, or HIV/AIDS. This is basically any underlying health condition. Masks. They prevent you from spreading the disease to other people. They don't stop you from getting the virus, because it enters through the eyes, nose, and mouth. Don't go and buy all the masks. There is a world shortage of them at the moment, and you're probably stopping people who actually need them. What to do to prevent transmission? Wash your hands frequently, and wash them for 20 seconds or more. Be generally 1.5 meters to 2 meters away from other people. Do not shake hands.
We must minimize physical contact with other people and encourage the elbow greeting rather, which is this, rather than shaking hands.
If you wash your hands as you enter your house, it is probably advisable. Social distancing, especially if you have the virus. This information is true to the best of my knowledge. If you believe that I have given some wrong information, please comment or send me a message and I will make a note of it. What does it feel like to have coronavirus? I'm going to leave a clip of someone describing what happened to them when they got coronavirus from Channel 4 News.
Joining us now, you actually got the disease early on, you recovered from it. Just talk us through the different stages and what they felt like.
Yeah, so this particular virus, it happens in different stages, as you said. You get better before you get worse. So in my case, the first stage was I had the cold. Just a common cold, my nose was stuffy. I had ear problems, sinus problems, that sort of thing. But then you get better before you get worse. So I was getting better, and that's when I got hit with the flu. Now, I've had the flu half a dozen times, and this was probably the worst I've felt with that. It really was quite bad. It wasn't life-threatening, but I did feel terrible. With the flu, I was stuck in bed. I had a headache. I just generally feeling unwell. I was getting better from the flu, and that's when I got hit with pneumonia. Now, the pneumonia, I've never had that before, so that was quite serious for me, and that's the point I went to hospital.
And when you had the pneumonia, just describe to us, and we've all heard the word, but none of us, or most of us, don't know what it feels like. What did that feel like to you?
Yeah, so pneumonia, it feels like you've only got 20% of your lungs working. You can't take a full breath like you need to. If you stand up and go and walk into the kitchen, you're out of breath because you just can't get that breath. It also sounds like you're breathing through a bag. Your breath is very crackly and croaky. It generally is not a fun thing at all, and it can be very, very serious.
And you're young and you look healthy, so that must have been a really scary thing.
Yeah, during that time it was. Just because I don't really drink, I don't smoke, and having that problem was very scary, just because breathing's vital to life. If you can't breathe, you can't live. And so having that being affected was quite a serious thing.
Conor Reid, thank you very much for talking to us. Good luck.
Why is social distancing important? If we don't take any protective measures at the beginning, we're going to have a big influx of people needing the ICU beds and the hospital beds. South Africa does not have a first-class health system in place. And if we exercise the social distancing with protective measures, we can ensure that there's enough beds in the hospitals for the people that need them. How long does it take for symptoms to start to show after you contract the virus? The incubation period is the time it takes from when you contract the virus to when you start showing symptoms. The incubation period for the novel coronavirus is somewhere between 2 and 14 days after exposure. The Center for Disease Control and Prevention has suggested it may be possible for the virus to spread before you start showing symptoms. Thank you for watching my video. Please share this video to anyone you think may need to know more about it.